The Kwara state government has flagged off a mass vaccination program to ensure at least 1.9 million Kwara residents get the COVID-19 vaccine before the end of January 2022. The mass vaccination program, which was flagged off on behalf of the executive governor of Kwara State, Malam Abraman Abrazak, by his deputy, Mr. Kayode Alabi, who conveyed the governor's message at the event, assured Kwarans that the Abraman-led administration will make COVID-19 vaccines accessible and available to the people of the states.
Kwara State government under the leadership of His Excellency Malam Abrazak left those still on front to see that the production of the vaccine in the state suffered no hit by promptly releasing critical funds to aid the implementation. The Kwara State government went further to demonstrate ownership by flagging off the campaign and publicly taking the vaccine. As the scope of the COVID-19 vaccination expands through mass vaccination campaign throughout the state, I want to encourage all and sundry to ensure protection against COVID-19 by getting themselves vaccinated. The vaccine has been adjudged to be safe and devoid of serious adverse events following immunization. I therefore encourage all Kwaras to get themselves protected by getting the vaccine. I want to especially thank the management of Kwara State Primary Health Care Development Agency, under the leadership of the State Secretary, Dr. Nusirat Elelu, in their resilience in ensuring Kwara gets vaccinated on a continuous basis since March 2021. The Kwara State government will continue to do its best to ensure that COVID-19 vaccine and other health services is made available and accessible to everyone. Thank you, and God bless you.
Speaking with newsmen at the event, the Executive Secretary of the Kwara State Primary Healthcare Development Agency, Dr. Nosira Elelu, disclosed that the agency have adopted several strategies in order to ensure a large number of individuals get vaccinated.
Question. Presently, we've been having, we had the first phase and the second phase. So the previous one, we're having a phased approach for the COVID-19 vaccination. So we've realized that if we were going to continue with this approach in the next 5 or 7 years, we are going to continue to vaccinate people for COVID-19 vaccine. So we said, okay, we must ramp up coverage for vaccination against COVID. And that is why you see what we refer to as the mass vaccination campaign. And this will involve, adopting several strategies, like including additional centers. Initially we were using 70 centers for the COVID-19 vaccination. So now we are ramping up the number of centers that are going to be administering COVID-19 vaccine, public places, tertiary health facilities, secondary health facilities, and we're also going to be having what we refer to as the mobile vaccination vehicles. So these vehicles, are going to see them moving around the city, especially places with high population, high volume, or hard to reach places, and they are going to vaccinate people that are eligible over 18 years. We are also going to have the mass vaccination sites like what we have here. You can see this is not a health center, but we have it as one of the first mass vaccination centers in the country, where large number of people are going to reach continuously on a daily basis. So that is what this campaign is about.
Dr. Elelu also revealed that the agency will establish a mass vaccination sites in places with large populations across the 16 local governments of the states.
We are going to have canopies here within a higher institution like the Federal the State Polytechnic, the Kwara State University, Molete, University of Ilorin. So you are going to see mass vaccination sites established in those places because we expect that large number of people will be vaccinated. And therefore, for mobile, you are going to see some marketplaces have 5-day market. So we're going to move from market to market with those mobile vehicles to cover also large number of people.
All right, your full name and what you are in the society, just for record purpose.
Okay, so my name is Dr. Nusirat Elelu.